is the second video on pharmacokinetics. If you haven't watched the first video about absorption of drugs, then please take a look on it first and then come here again. Hello everyone. So let's start with biotransformation. It is basically metabolism of the drug inside our body. It means chemical alteration of the drug in the body. It is needed to render non-polar compounds, that is lipid soluble compounds, into polar ones, so that they are not reabsorbed in the renal tubules and are excreted. In the absence of metabolism, body will not be able to get rid of the lipophilic substances and they will become very long acting. Mechanisms which metabolize drugs have developed to protect the body from ingested toxins and other environmental chemicals. The primary site for drug metabolism is liver, while others are kidney, intestine, lungs, and plasma. Now, let's learn about effect of biotransformation on drugs. So, biotransformation may cause inactivation, formation of active metabolite from an active drug, and activation of inactive drug. Classification of biotransformation reactions. They are mainly classified into two types: non-synthetic or phase 1 or functionalization reactions, and synthetic or conjugation or phase 2 reactions. So, in non-synthetic or phase 1 reactions, a functional group like carboxylic, alcoholic, aldehyde or amino etc. is generated or exposed. Metabolite may be active or inactive. In synthetic or phase 2 reactions, an endogenous radical is conjugated to the drug. Metabolite is mostly inactive. Non-synthetic reactions include oxidation, reduction, hydrolysis, cyclization and decyclization reactions. And synthetic reactions include glucuronide conjugation, acetylation, methylation, sulfate conjugation, etc. Now, with the help of a diagram, let's try to understand these reactions. Here, a drug goes to phase 1 reaction and becomes a metabolite, and then goes to phase 2 reaction, whereas some are already conjugated and hence can directly go to phase 2 reactions. And as you can see, the overall process leads to a final step, that is excretion. But before excretion, metabolism of drug inside our body occurs. Let's learn about that first. In first pass metabolism or presystemic metabolism. This refers to metabolism of a drug during its passage from the site of absorption into the systemic circulation. All orally administered drugs are exposed to drug metabolizing enzymes in the intestinal wall and liver. This can be avoided by administering the drug through sublingual, transdermal or parenteral routes. The extent of first pass metabolism differs for different drugs and is an important determinant of oral bioavailability. A drug can be excreted as such into bile. So, the hepatic extraction ratio, that is ER of liver, of a drug is the fraction of the absorbed drug prevented by the liver from reaching systemic circulation. Both presystemic metabolism as well as direct excretion into bile determine the ER of liver, which is given by the equation ER equals to CL of liver to that of hepatic blood flow. Now, we got attributes of drugs with which first pass metabolism. Oral dose is considerably higher than sublingual or parenteral dose. There is marked individual variation in the oral dose due to differences in the extent of first pass metabolism. Oral bioavailability is apparently increased in patients with severe liver diseases. Now, let's move towards excretion. Excretion is the passage out of systemically absorbed drug. Drugs and their metabolites are excreted in urine, feces, exhaled air, saliva, sweat, and milk, etc. For overall cycling of drugs, let's take a look on this diagram of enterohepatic cycling of drugs. Here D is for drugs and DG together is drug glucuronide, which goes into the gut through bile and some part goes to systemic circulation. Once again, take a look on this, and now let's move towards renal excretion. The kidney is responsible for excreting all water-soluble substances. The amount of drug or its metabolite ultimately present in urine is the sum total of glomerular filtration, tubular reabsorption, and tubular secretion. That is, net renal excretion can be calculated by addition of glomerular filtration with tubular secretion and by subtracting tubular reabsorption. So this was all about metabolism and excretion of drugs in human body. See you all in the next video. Till then, stay safe, take care. Like, share and subscribe to my channel